Picture this. You receive a piece of shocking news and almost instantly your chest tightens, your breath catches, and your body signals that you are having a massive heart attack. But inside your chest, your heart isn't suffering from a blocked artery. Instead, your mind has just waged a chemical war against your own heart muscle. Let's talk about a medical mystery that proves human emotions and physical trauma are far more intertwined than we ever thought. For decades, doctors believed that severe chest pain and a failing heart were strictly plumbing issues, clogged pipes cutting off the blood supply. However, the discovery of Takotsubo cardiomyopathy, commonly known as broken heart syndrome, flipped that entirely on its head. Today, we are going to visually break down exactly what happens to a broken heart, how overwhelming stress forces it to reshape itself, and why understanding this profound mind-body connection could literally save your life. Imagine walking into an emergency room with a 65-year-old woman who has just survived a terrifying car crash or suddenly lost her spouse. Her electrocardiogram shows the classic, terrifying spikes of an acute myocardial infarction, and her blood tests reveal elevated cardiac biomarkers like troponin. The medical team rushes her to the catheterization lab to clear the expected blockage. But when doctors perform a coronary angiogram, they find that her arteries are completely clear. Instead, the doctors witness something incredible on the imaging screen. The lower part of her left ventricle, the heart's main pumping chamber, has ballooned outwards and stopped moving entirely, while the top part contracts furiously to make up the difference. Her heart has literally changed shape. This phenomenon was first documented by Japanese doctors in 1990. They named it Takotsubo because the paralyzed ballooning left ventricle looked exactly like a traditional Japanese octopus trap, which has a narrow neck and a wide, round bottom. While this classic apical ballooning is the most famous, we now know there are other variants, sometimes the midsection balloons, and in a rare variant called reverse Takotsubo, the base of the heart is paralyzed while the bottom works overtime. What's truly fascinating is that about 90% of the patients who suffer from this condition are women, mostly after menopause. Researchers suspect that the drop in protective estrogen levels later in life leaves the heart's microvasculature incredibly vulnerable to stress. How exactly does stress reshape a vital organ? The answer lies in your body's sympathetic nervous system and the complex brain-heart connection. When you endure an extreme psychological or physical blow, anything from the grief of losing a loved one to the sheer panic of an asthma attack or a stroke, your brain panics. People with pre-existing psychiatric conditions like anxiety and depression have an even greater sympathetic response to acute stress, making them highly susceptible. Your brain releases a massive toxic flood of stress hormones, primarily adrenaline and noradrenaline, directly into your bloodstream. Researchers believe this intense catecholamine storm essentially stuns the heart. It can cause the tiny microvessels in your heart to violently spasm, severely restricting blood flow to the tissue. Inside the heart muscle cells, the toxic overdose of adrenaline forces the tissue to temporarily shut down its pumping action. By doing so, the cells protect themselves from beating themselves to death, a drastic survival mechanism reflecting how deeply our mental state manifests physically. While a broken heart sounds poetic, the triggers can be brutally physical. In fact, male patients are more frequently diagnosed with this syndrome after severe physical stress, like an accident, sepsis, respiratory failure, or major surgery. Crucially, research from the German Center for Cardiovascular Research has proven that when a physical illness or trauma triggers Takotsubo, the patient's prognosis is significantly worse. These physically triggered patients face a much higher risk of life-threatening cardiac arrhythmias, repeat heart failure, stroke, and death compared to those triggered by emotional shock alone. The physical toll of bodily stress on the heart is undeniable and exponentially more dangerous. The silver lining is that, unlike a standard heart attack that leaves permanent scar tissue, Takotsubo cardiomyopathy is primarily a temporary stunning of the heart muscle. For most patients, the heart starts to wake up, and left ventricular contractility typically normalizes completely within 4 to 8 weeks. However, this is not a harmless condition. During the acute phase, patients can suffer from fatal complications like cardiogenic shock, where the heart becomes too weak to supply blood to the body. Furthermore, advanced cardiac magnetic resonance imaging reveals that even after the heart appears to pump normally, patients often endure lingering symptoms like severe fatigue. The heart tissue can harbor low-grade myocardial inflammation and macrophage accumulation for up to 5 months, leaving their cardiac energy reserves severely depleted. Recovery can be significantly delayed, especially for older patients or those with neurologic disorders. The reality of Takotsubo cardiomyopathy proves that the division between our mental health and physical health is a complete illusion. Extreme stress, whether it stems from a sudden emotional tragedy, chronic anxiety, or severe physical trauma, manifests directly in our tissues. Your heart physically bears the brunt of your brain's alarm system. The key takeaway is that we must treat psychological and physical stress with equal severity. Ignoring emotional trauma or trying to just push through intense physical exhaustion doesn't just harm your mind, it directly threatens the structural integrity of your heart. If you found this visual breakdown of the human body's stress response eye-opening, be sure to hit that subscribe button right now. Drop a comment below and let us know your thoughts on how emotions impact our physical health, and we will keep exploring the incredible mysteries of the human body. Stay informed, manage your stress, and take care of your heart.